Hi, everybody. I'm Rob Hoyer. Welcome to the podcast Dr. Doc. This is a podcast about lifestyle medicine and preventative healthcare. I'm a medical oncologist, and I'm joined by my friend and colleague, Dr. Abbass Shafii, who's a gastroenterologist, otherwise known as a GI physician. Abbass?
Hi, my name is Abbass Shafii, as Dr. Hoyer mentioned. We've been working together for many years. Through the years of our experience, we have noted that many of the disease that we manage can be prevented by patient education and dietary modification. So we are hoping that we can inform people based on the knowledge as well as daily lifestyle to make their quality life daily better, as well as preventive many chronic disease.
And one of my interests is cancer prevention, and specifically primary prevention for cancer. I've worked with oncology patients for about the last 20 years and have really come to recognize that there's a huge quality of life decrement that happens during cancer treatment and after a diagnosis of cancer. Really, life can be very different for patients after a cancer diagnosis, and there's a lot of things that can change in the body. And for example, after surgery, after colon surgery for colon cancer, for example, digestion can be very different, bowel habits can be very different. And that's just one of many things that can change. Chemotherapy has a ton of side effects that occur during the treatment and afterwards. And so I've really come to recognize that preventative oncology should be something that's talked about much more in primary care and actually implemented in primary care. I feel like in American medicine, we're only really doing half of what we should be doing. Certainly disease treatment is important, so I think that's certainly a hallmark of healthcare is treatment of diseases, but we need to give some time to preventative healthcare and specifically primary prevention. And one of the main ways that can be implemented is through lifestyle medicine. So that's my interest in this, and something that we'll be talking about in future episodes. And so very excited about this. And Abbass, any other comments?
Yes, as a gastroenterologist, I see daily people with many symptoms. And some of these symptoms, they're the warning sign for the individual that the progression of the disease can turn to cancer. For example, typical gastroesophageal reflux disease that we see more and more. And this is, I tell my patient, this is like a warning sign on your dashboard of the car. You can take a medicine or unplug the lights, but this will come eventually causes more permanent damage, which we just have erosive esophagitis, then to Barrett's esophagus, subsequently to esophageal cancer. This is one example that if the patient from the early on understand the diet and understand the physiology, understand what's the body allowing him to do, can easily prevent from this common fast-growing cancer. The other disease, people with today's industrialization of the food and processed food, they get many gas, bloat, as well as irritability, and that can change all the microbiome of their bowel and consequently causes a lot of inflammatory process from arthritis to many other diseases. So these are all can be prevented on individual basis just by simple modification of their diet.
Thanks, and I completely agree. One of the concepts that I've come to recognize in health is about this concept of health span, and I talk about this in my newsletter, which comes out about every 2 weeks, and we'll put a link to that in the show notes. And this concept of health span is a little bit subjective, but it basically is lifespan plus quality of life. And of course, that's subjective, and everyone's quality of life and how they rate their quality is individual. But it's something that I think it's a common concern that we certainly don't want to be, or we want to be living with as few chronic illnesses as possible. And so this concept of being alive and healthy, but also not having to take medications or undergo ongoing treatments, is something that we want to focus on with this podcast, this concept of health span. And also what I've come to recognize is what we do as physicians is that at a very fundamental level, physicians are really time extenders. That's why physicians are a common component of all societies. And this is something that we as physicians try to help patients have longer lives, better quality of life. And really that's the health span concept right there. So as I alluded to before, we focus on a lot of the disease treatments, but we don't spend a lot of time with prevention. And the issue with that is, and we'll have writing my next episode or newsletter 4 right now, we are really being deprived of time. In the U.S., we're spending a ton of money with healthcare, but our life expectancy is actually it's plateauing. It's not increasing at as high a rate as other countries that spend 2 to 3 times less per person for healthcare every year. And so we'll get into some of the incentives and why we're not focusing on primary prevention. But I think it's a really important concept. I just want to make one other comment about the use of technology and what I've come to recognize with studying and learning from people like Peter Diamandis, Elon Musk, these individuals, this concept of exponential growth and how technology can really enable individuals to take control of their lives. And so the individual is really the fundamental component of our society, and with technology, the individual can be unstoppable, actually. So one of the goals of this podcast is to help individuals become health sovereign, independent, in that you can become the CEO of your own health. And you hear that a lot, but how is that actually implemented? What are the tools that are out there? What are the pitfalls? And so that's some of the things that we'd like to discuss with the podcast. Any other comments, Abbass?
Yes, I think I tell my patient that the most important investments of their life is their health. No matter how beautiful car you have, no matter what great bank account you have or nice home, if your health is not optimized or not the best, those are become meaningless. And I should see that daily in my daily practice. And the investment in the health is very simple. It's just you need time and effort as you do for work, for other type of things, as for your sleep. You need the time for your daily health, spending time choosing the right food. I tell patients, the more time you spend in your kitchen, the less in doctor's office, and fast food, fast life. So you need to invest on choosing the proper hydration, like water, and eating properly, home cooking, eating breakfast, lunch, lighter dinner, and have at least 30 minutes exercise daily. It really does not take that much, but the longevity at the end, the payoff is tremendous, better than any account that I know. I know people are healthy, they're living longer times, they have better quality life as they get older. So as gastroenterologists, as well as traveling around the world and see people investing in their health in different way, today we have the most knowledge of all the nutrition, as well as not from us, from many other countries, but unfortunately we are at the worst times at least in America and becoming the rest of the world, from investing in our health and with this industrialization of the food and drinks, and not spending times on our own kitchen and preparing our own food.
And I'll just add to sum up, we're living in an amazing time. there's so much happening in medicine and many other fields that technology really is changing our lives literally every day. There's changes that happen, and this whole the next era of medicine is going to be longevity, and will be a multi-trillion-dollar market. And one of the things that we'd like to focus on is to help prepare you for what's coming, because all these anti-aging technologies are some of them are here already, and we'll be talking about them on the podcast. But this is the next era, and it's important to have a foundation. You have to be healthy to start with. These medicines are not going to suddenly make you healthy, but they can and will extend your life. But you have to have that healthy, basic foundation: diet, exercise, stress management, sleep, relationships, all these things that we'll talk about lifestyle medicine in a few minutes. So we're excited you're here. We're glad you found us, and welcome to the podcast.
Hello again. My name is Abbass Shafii. I'm here with my friend and colleague, Dr. Rob Hoyer. Welcome to Dr. Doc podcast for longevity as well as preventive medicine. On the last episode, we talked briefly about our goals as well as preventive medicine. Today, we want to continue on the same topic. One of the important goals that I see in my practice, people, they in their teens and their 20s and early 30s, they try completely forget about diet and exercise, and they think that there's magic pills on 40s and 50s comes and they can live forever. However, from the time that you are born and you drink your mother's milk to the time that you die, that all of this will influence your life on a daily basis. You cannot be extremely cautious, but you have to be reasonable. You have to live your life to the fullest, as well as beside the daily exercise and eating habit, the stress management, adequate sleep, as Rob mentioned in the previous episode. So this is a long-term investment as you do with your banking or your investment in your home. So you have to have a long-term goal and not think that you do this, exercise, but don't eat right, or go to the extreme diet that what you have done in the past claim. Some of those are helpful, but preventing the disease such as cessation of smoking, excess of alcohol, as mentioned, stress management, the fast food, the processed food. So those are all helpful in the long term for preventive medicine, as well as preventive cancer, as well as improved daily quality of life.
I entirely agree. It has to do with a lot of this. What we're talking about is really time preference, and we live in a society of very high time preference. So things happen quickly. We try to save time wherever we can, fast food, whatnot. And the idea is that, well, by reducing the time to prepare the food or eat the food, we can then have some other gain of time later on, or save time for other purposes. But sometimes we're busy, we need to eat quickly. I understand that, but it's really, when you step back a little bit, looking at what a low time preference entails. This is in many ways going back to a time when food was sourced and prepared locally and made at home, and the benefits of that are substantial. When you look at some of the many of the components of the actual food itself, the microbiology of the plant or the food you're eating. So plants have a microbiome too. So plants have, for an example, an apple has literally thousands of different bacteria that are on it. And when we eat that apple, we attain some component of that microbiome, and that then becomes part of us. And so this is something that there's some very fundamental components of a low time preference view on health. And it's something that we'll be talking about a lot in this podcast because it's one of the key tenets of lifestyle medicine, which is the use of diet, exercise, stress management, sleep, both duration and quality, and combining all these things. When I speak with patients, I talk about stacking these different components, and individually, the effect of some of these is fairly small individually. But when you actually start stacking them, that's when you can actually get the massive gains. And so 5 or 10% improvement, but then each one of them, think of it as 5 to 10%, and you're starting to stack those together, and you can actually have some really sizable gains. And that's not just in not just in terms of your overall health and longevity, but also how you feel. It can be, and this happened to me when I started really looking at lifestyle medicine and really focusing on diet, exercise, and sleep. Just those three things right there. It was incredible how much better I felt, how much more energy I had, and how my mind was clear. Add into that meditation and start doing some other components of just focusing on relationships, and it actually starts to change the way you look at the world, and that it's really an amazing process. And so we hope to help our listeners begin that process wherever you're at on that continuum, just starting out, have done a little bit. Maybe you're into this already, and so we'd love to hear your feedback about what you're doing. And so there's a lot of components of this. And I also want to say this is not a one-size-fits-all. Everyone has to find their own individual way to do this. We can give you some tips, get you started. Some things will work great. Some will not work at all for you, and that's just fine. If it doesn't work, just put it aside. Maybe later, it's something you can come back to. But it's important to have an open mind. We're going to be, myself and my family, we've tried a whole bunch of different things, and some work, some don't. You got to find what works and is sustainable. So part of that low time preference is small changes over a long period of time can have a huge impact. And that's really what we're focusing on here.
Yes, the life is nothing but consequence of multiple habits. So what we need to do, correct our little by little daily habits, and when we change those daily habits, it becomes a routine for us. Then we can improve it as the time goes on. As Rob mentioned about the quality of food, when you take an apple, for example, from a tree or harvest any food, from the time that you take that from its base, it start losing nutrition. So that's very important to eat within 9-10 radius of where you are. If you can, if it's possible, you can. As well as the cooking at home or preparation is not just cooking the food, is the senses being there, calming effect and solving family problems. As know as myself, majority of the weekend when I spend time with my sons, my family, it's not really the cooking, it's not the eating of it, it's just sharing our thought, learning from each other's experience, and they see that. And the majority of this habit happens at a young age. So if you prepare food and if you have a good habit of healthy eating, then consequently your children will follow, and then consequently their children will follow. So this is a sort of a community or familial things. And what I see in the elderly patient, when they go to the nursing home, assisted living, that washing the dishes or preparing food, that was by them, it was a physical therapy. Suddenly they go over there after a month or two, they feel like their hands, they're not moving, they're not doing anything. And then consequently, you see that simple daily work was a part of physical therapy that keep them looking forward. And of course, we have to have goal. We have to have hope to keep that going on. So I think with investment in our health and exercise, then consequently you see less doctors, the more saving on the account. As today we see the health insurance is so expensive, medicine so expensive. So it's become an industry that treating all of this is then the saviors going on vacation and having an optimum lifestyle is, I think, overall will pay off.
I really like what you said, because mindset and mental health is so important in all this. And really, you can do all the diet and exercise and sleep, but if you're anxious or stressed out, depressed, this will have a huge negative effect on your health. It's been seen in patients with cancer that cancer patients with higher cortisol levels do poorly, and that cortisol is a marker of stress. And so it's interesting working with cancer patients. You can see the stress in the patient, but also in the caregivers. And there's a study that we're participating in at our local, at our regional university, looking at stress management for caregivers. I thought it's an NCI, National Cancer Institute sponsored study. I thought that was really interesting because stress management is so crucial. And in our society, basically what's happening, we live in a society where everything is trying to compete for our attention, and they're trying to get our time. And so unfortunately, a lot of that is just time that's wasted. It's time, whether it's marketing or other things that doesn't add any net value to your life. So part of this conversation is how to have a good mental health, and I recognize that's a process. It's not something that just happens overnight, but it is all about mindset. That's really your most precious resource, and how to focusing on that is really key. I should note Peter Diamandis, he has a digital subscription platform, and I encourage everyone to look at that. It's called Abundance 360, and talks about this. But one of the biggest components is about mindset, and there's different mindsets. There can be longevity mindsets, or different entrepreneurial type mindsets, or there's different mindsets that one can have. But that's something that we'll definitely be focusing on with this podcast, because that's really the core component of our life, how we interface with the world, the lens through which we see the world. And that's something that is a process, and I encourage everyone to start thinking about that. So Abbass, any other thoughts?
Yeah, another thing I was going to mention is about our genetics. So genetic and microbiome and how we live. If you look at today's America, globalization, and we lucky to live in the United States, and we have so much interaction with people from different cultures. So at one lifestyle works for one person, does not work for other person. If you look at Native American, or you look at Hawaiian, or you look at different genetic of the people, you see if as long as they stay with their lifestyle that the ancestors they live, they have a better longevity. The perfect example is Hawaiian. If the Hawaiian, they stay with Hawaiian diet, do the ancestral type of work, stay in a farm, stuff like that, their longevity is very long. However, when they get introduced to the modern life, or the flour, the sugar, the fast food, majority of them become diabetic, and once become diabetic, hypertension, other type of disease happens. One of the best example is in certain Japanese island, where the people they live on American basis, they have low life expectancy, increased cancer, increased more of chronic medical problem. While the people they live in villages far away from modern civilization, they have much happier life, they live longer, and the life may be much simpler. Maybe they do not have as much as luxury, but however, the longevity and their happiness is quite well known. If you follow some of the blue zones studies, that's pretty much a little macrocosm of what life can bring, and you can create that zone for yourself despite where you live. So an individual can create those things, whether you live in a big city or a small town. You can create your own lifestyle based on and enjoy yourself. It doesn't mean that you have to be all stiff and to one dietary or one exercise thing, or all thing well-being and being happiness. That I think what make us to live a longer life and with less disease.
Hi everybody, welcome back to the show. I'm Rob Hoyer, medical oncologist, and I'm joined by my friend and colleague Abbass Shafii, who's a gastroenterologist. we'd like to talk about some of the, just some brief overview of the diseases that can be prevented and potentially treated with lifestyle medicine. And so this is not meant to be an expansive list of different diseases, but just wanted to give you an introduction to how we think about some of these diseases that are actually quite common, but by following some of the key components of lifestyle medicine, you can actually successfully evade or even reverse some of these conditions. So I'll let Abbass start out with some of the gastroenterology diseases, what we call GI diseases. Then I'll finish up with some of the common cancers, and we'll start out. Abbass.
Hello. As a gastroenterologist, about 70% of the patient, the disease that I see can be easily self-managed and prevented just simply for lifestyle modification. Of course, then subsequently medicine, and if need, the surgical intervention needed for certain of them. But if we start early on life to do that and develop good habits and listen to our body tells us exactly what we're doing. For example, one of the common problems that we just see the top of the iceberg in the clinic is gastroesophageal reflux disease. I think everybody had at one time had acid reflux, which is not unusual, but when it becomes a daily change in the lifestyle and when people cannot sleep well, and then bodies give you the warning that what you're eating. And I can tell my patient there's 3 things that gives you acid reflux. Number one, the volume of what you eat, then what you eat, and what time you're eating. So if you adjust some of those things, and then consequently, majority of them can be treated without medicine. And this is just a temporary, it will increase quality of life, sleeping better at night. When acid comes to the esophagus, subsequently, the body wants to prevent from any aspiration. Then patient keep, even they're not awake, they cannot get good night's sleep. They keep waking up. And so that's just by itself is ties to this sleep patterns. And then the next day they're uncomfortable, and the next morning they do not want to eat breakfast, and then becomes a vicious cycle. So this is one of the simple things that we see. The other thing that we see today is fatty liver, and then that is again due to processed food or eating of the carbohydrates and lack of exercise, which is also ties to gastroesophageal disease as well. This is the beginning of what else to come when the liver is overwhelmed with a poor diet, then consequently diabetes, hypertension, cholesterol, then consequently heart disease as well as stroke. So this is again can be simply managed. It takes time, it takes effort, but can be done. Another common disease we see is irritable bowel syndrome, which is in most cases can be managed by stress management as well as the dietary. Some people they avoid eating because they have to get tummy aches when they eat. Then consequently, the longer they eat, and when they eat, they get more bloated, more gas, and as well as what they choose to eat, they extremely go to the diet of legumes and other things, try to stay healthy, and or they go too much fast food and processed food as well as with stress. So those are, if you with adequate hydration and proper stress management can be done. And today is one of the biggest frontier of the medicine is the bacteria that grows in our system, particularly in the colon. This is a hallmark, I think, of the future of the medicine for preventive inflammatory process such as arthritis, coronary artery disease, and cancer, and all of that. So this is very important for keeping our balance of the bacteria. And I believe the the bacteria for each individual is different. For example, a Native American is different than Caucasian, and an Asian-born diet is different than for example, people they live in Alaska. So we need to see what works best for all of us, and I think we just know very little about this. And then consequently, when we keep that balance, we have a better quality life and less chronic diseases. So these are some of the few topics that we can have for introduction, and we can talk to this each individual topics more in detail in future.
Thanks, Abbass. That was great. And I'll just add a few comments about cancer and cancer prevention. So we're taught as medical students, and when we do additional training, what's called a fellowship in oncology, that cancer is a disease of the elderly. And yes, that's true. Not all cancers occur in the elderly, of course. So this is general trends that we observe, that as individuals age, there's a higher likelihood of developing cancer. That's commonly accepted medical knowledge. So how to prevent cancer? Well, the key component, and we'll talk about this in detail over a series of podcasts, is you have to slow your aging. Well, how do you do that? Well, one of the best ways to do that right now is lifestyle medicine. So there actually are ways to study your biological age through what's called DNA methylation studies. These are widely established evidence-based approaches to looking at biological aging, and it can be done for about $100, or some are $200, but you send off a saliva sample and you can actually get your biological age. I encourage everyone to do that because it's a great way to check to see where you're at, and you need some data to actually show, okay, where am I at on this biological aging versus chronological age, and you can actually create a ratio of biologic age to chronologic age, and it's something that you can use to form a foundation for subsequent lifestyle changes. So that's something that is really a key starting component. And then when you get into some of the different cancers, for example, gastrointestinal cancers or GI cancers, and that's my area of interest, and I see patients mainly with gastrointestinal cancers. So that includes esophageal cancer, stomach or gastric cancer, pancreas cancer, and colon and rectal cancer. It's not surprising that all of these diseases have been linked to lifestyle factors. So, for example, smoking with respect to esophageal cancer, and of course lung cancer and oral cancers, with stomach cancer with diet. So high salt, high preservative diets, higher risk of gastric cancer. That's been well established. Pancreas cancer, we're not so sure about the risk factors, but clearly obesity and diabetes are a risk factor for pancreas cancer, and smoking as well. And then of course colon and rectal cancer, probably the most studied of all those, even potentially combined, diet and lifestyle. So fiber is a key component of all these diseases, and fiber is protective. And in my study of this literature and reading about this, I don't think it's the fiber per se that's providing the anti-cancer benefit. I think what it is the fiber is the food for the microbiome, and this is the key. That's the key component, and that's why when you think about, so higher fiber diets have been linked to reduced risk of breast cancer. How on earth does that work? I mean, that doesn't seem to make any sense. You eat more fiber and you prevent breast cancer. Well, it's probably an effect via the microbiome. And so we now have the tools to mechanistically study how these lifestyle factors impact cancer risk. And I find that really interesting. I've always been interested in biological mechanisms, and that's why I went into medicine. That's why specifically oncology, because I was fascinated by the cancer cell and all the different pathways and targeted treatments. And I 20 years ago saw this huge tidal wave of new oncology treatments that we now have. Immunotherapy, targeted therapy. It's getting really, really advanced in terms of what we can do. But I've come to recognize that that's not the solution. That's a treatment of cancer is important. So I'm not trying to reduce the importance of that in any way. If you have cancer, of course, go to your doctor, get treated. Absolutely. However, we now have the power to use lifestyle medicine and tools to actually prevent the cancer in the first place. And so this is something that, genetics are important. However, when you really look into genetics, it probably accounts for no more than about 10% of cancer risk. Cancer is a lifestyle disease. And this is a key component of what we're going to be talking about in our podcast, because it's such a fundamental component of medicine that is often overlooked, or it's not stressed as much as the treatments. But the individual has the ability to implement these changes. For example, implementing a change 10 or 20 years can drastically reduce cancer risk, and there's good data to support such. And so this is what we're talking about. So low time preference, implementing changes over a long period of time can have a huge benefit in terms of reducing risk of and many diseases, and also can treat many conditions as well. It's well established that diet and exercise after cancer diagnosis, specifically for colon cancer and breast cancer, will reduce risk of recurrence of that cancer. I'm not talking about a new cancer, but actually will reduce risk of recurrence of the cancer that the person was diagnosed with. And so how does that work? And so it's interesting. We've had this data for many years, and for colon cancer over 10 years, for breast cancer about the same time, but it's not all studies have shown the same effect, but there's methodological concerns with some of the studies, but diet definitely has an impact. So it's well established. A recent study showed that low-fat diets showed a improvement in we call mortality, or risk of dying of breast cancer. Interestingly, it did not affect risk of recurrence of breast cancer, but affected risk of dying from breast cancer or another condition. And so that was really interesting. So we'll talk about that, get into some of the mechanisms, and look at those studies in more detail. That's something we'll be delving into with the podcast as well. So there's a ton of information here. And so what we're hoping to do with the podcast is try to distill this down, start a conversation. We're not going to be able to cover every single topic, but it's important to look at some big trends. And that's what we do when I see patients in clinic, is we look at, okay, well, what can we start with? Let's start with a lifestyle change. For example, let's try to reduce processed food. Let's try to eliminate sugar, like soda. And of all the diets, no matter what diet you follow or subscribe to, I have never seen a diet or evidence that shows that soda or processed food is beneficial. And so this is something that these are easier things to start with, and that's a great way to begin the journey. And that's a place you've got to start somewhere. Abbass, any other thoughts?
Yes, I think there's a few things that in reality we cannot change our genetics. The second thing, we cannot slow down the aging, but we can slow down the biological aging. But the rest is really what we do with our life. Again, is diet and exercise and living a reasonable life. There's so many people, they gain weight and they spend so much money on all this crash diet, and they do not work, they go back to the same thing. So we need to have a long time goal and habits replacing good habits from the bad habits to consequently to achieve our goal. When I see a patient, I says, well, we work as a team. You do the ABC, and then once that's then we do the medicine and we do the diagnostic to help you to live a better, comfortable life. In general, when I study the majority of the diet in the whole world, and as Rob mentioned, number one is hydration. And sometimes they change, put the color in the water, they sell it to you, but it's basically having adequate water to hydration, cleansing your body. Number two, appropriate diet for each individual. Majority of the energy should be consumed during the working hours, less during the night. I believe during the night we go to a hibernation, as most animals do. That's where our cleanse our mind, our body. The same thing, your digestion should be also resting. But unfortunately, with today's lifestyle, we work all day and we eat big dinner and we want to go to bed. Yes, we pass out, but the same thing, our body is not at a harmonious time, at not relaxing times. So then the consequence, we don't want to eat breakfast. So I think for the longevity, we need to have a long-term goal to be able to implement this to our busy lifestyle. But I think if you invest half an hour to an hour to your health today, the consequence is better than any bank account when you're in the 50s, 60s, 70s can pay. And the disease is not only what happened to you, as Rob seen it, myself seen it. When you get, for example, colon cancer, or you get pancreatic, or any disease, or an ulcer, it not only affects you, affects your family, affects your people around you, your works, how you're thinking. So all of this thing will tie up to just to longevity and preventive medicine that our goal is to achieve in our podcast.